Summit. In this session, we are going to be talking and diving deep into residencies and fellowships. I'm so excited to be here with Dr. Brandon Poen. He is the amazing creator of the Healthcare Education Transformation podcast, and he's also a wonderful physical therapist who's currently going through a fellowship. So I thought he'd be perfect to share the ins or outs of residency and fellowship and really help you know if that's the right choice for you and how to help it grow your career. Thank you, Brandon, for being here.
Well, thank you so much, Emma. And I must clarify, I'm certainly not an amazing person. I'm just learning every day like everyone, trying to be a little less wrong every day. So it's been great. And thank you for what you're doing with this initiative. I applaud you. And thanks for inviting me to chat on today. Looking forward to diving into this.
Yeah, I'm so excited. So in case anyone doesn't know what a residency or fellowship is, do you want to sort of give just a brief overview of those two distinctions?
Sure. So if we're thinking about a residency, what a residency basically is, it's a post-professional program. So basically after you graduate from a PT program, in which it basically has a planned learning experience involving a curriculum that basically goes through fundamental knowledge, skills, and responsibilities of a clinician within an advanced skill set in a defined area of practice. So if we look at ABTRE, which is the American Board of Physical Therapy Residency and Fellowship Education, basically the credentialing avenue through APTA, there are 11 clinical specialties and one non-clinical specialty. So there's, of course, acute care, cardiovascular pulmonary, clinical electrophysiology, geriatrics, neurology, oncology, orthopedics, pediatrics, sports, women's health, wound management, and of course, faculty. Most programs are about a year, and they involve a combination of, of course, clinical practice, mentoring, and didactic information. Following that, of course, the expectation is that individual takes the board certification exam, depending on that specialty. So that's kind of basically what a residency is. So it's really more broad defined area of practice, where a fellowship is an even deeper dive into one of a subspecialty of one of those practices. So say I complete an orthopedic residency. If I want to do a fellowship, I'm going to go into either spine or orthopedic manual physical therapy. So it's kind of a deeper dive into one of those subspecialties of it. Fellowships, there's not quite as many compared to residencies. If we kind of want to get how many there are a few. There's critical care, hand therapy, movement system, neonatology, orthopedic manual physical therapy, performing arts, spine, sports division 1, and upper extremity athlete. And there is a higher education leadership fellowship for, it's called the ELI program. Basically, it looks to take people that want to be involved in leadership within a program. So we've had a few people on to talk about that program and such, but yeah, I mean, fellowships usually are about 2 years, and on average, I mean, there's a couple programs I know that they get people out really quickly, and then there's some you can do it up to 3 years. But after you do that, you have to take this test at the end of it, and then you have to go through, meet all these sets of standards and all these kinds of regulations and complete all these requirements, and then you have fellowship status.
Okay. Now, do you need to take a residency and then fellowship, or can you go right to a fellowship?
So it depends on your program, but as it stands now, and we can get into this a little bit later, but as it stands now for orthopedics and such, you do not need to have a residency in order to get into a fellowship. However, there has been talk, one of the ABTRE kind of changes that they'd like to make is making it so that in order to go into a fellowship, you have to either complete a residency or have your OCS. So there's been a lot of debate and discourse over that very topic. So that's why I'm saying now it's technically no, but that might change.
Maybe get in while you can before it does change.
Well, it's supposed to take effect in 2020. Like that regulation is supposed to take place in 2020 as it stands now. So we'll see what happens with that.
Okay. Well, that's a good distinction because I actually didn't really know a lot of the differences between residency and fellowship. So that's good to know that the time frame is 1 year versus 2 years. And
give or take, yeah.
It's just a little bit more specialized. Can you dive into like the pros and cons of each, and how do you choose between the two? Because they sound very similar.
So I think let's first ask a little bit of like, why should we do residency or fellowship? Because some things we really have to consider, of course, as PT students and as newer graduates, one of the bigger things that's a concern is, of course, finances. So that's debt coming out of school. Because one thing we have to know is that residency and fellowship is not cheap. It can be rather pricey, and it depends on what program for residency, because some residency programs actually you can, I mean, yes, you still work as an employee and you make a salary. You'd make far less than you would as a regular full-time clinician at another clinic. So that does vary with that. But there are certainly pros with it. I mean, there definitely are. Really good things. You have a planned set curriculum that's all set out. You have planned mentorship, and they have time for mentorship for you. That's sometimes really hard in a job where you're kind of on your own. Because a lot of employers will say they offer mentorship, but when you really ask specifically why, you kind of really get a better sense of what that really means. And truthfully, when if we're completely honest in clinic, when push comes to shove and we're really struggling for units or it's a rough month, one of the first things to go in the clinic is those education times, is
Yeah.
to get another patient in there. And I get it. That's kind of the way it is. Now, do I think you necessarily need to do that to get to growth? No, I don't think it's required. I think it's harder because I think you have to really know yourself. You have to really set up a program and a plan of study for you. And I think finding a quality mentor can be done without a residency, but you have to really do a lot more legwork to find that person and obviously get them to be your mentor. So I still think you can do it, but I think with the residency, you have a little bit more security in getting some of those things, and you kind of know you're applying to a standard, like they do meet ABTRI standards. So you're basically getting a relatively consistent program. I mean, there is variability between programs, don't get me wrong, but you're not wildly off base.
Yeah, that's it. That's a really good point that you bring up. One of a huge pro. I mentor a lot of new graduates and they always want actual mentorship, like clinical mentorship. And I have to tell them the harsh reality is that the clinic is just so busy. You're not going to get that 30 minutes to practice that spine manip. It's not going to happen. I mean, you're going to get talking at lunchtime, maybe a quick question to your coworker while you're treating someone, but it's not going to be actually formal like it is in a residency and a fellowship. Are there any other really big pros that you see to choosing a residency or a fellowship?
Sure. To go back to your last point, I think it does. I mean, I think there's definitely clinics where you can do that. I mean, I think it does depend on your clinic culture and who
Yeah.
you're working with, because I mean, I've worked at one place. There's been people that have been more than willing to say, "Hey, you got an opening. Let's practice or let's talk about this." Is it harder to do formally sometimes? Yeah, but can it be done? Of course it can. So it's definitely not a set in stone thing for sure. Other pros with kind of really going into it is you really expand your network a lot. You make connections with, I mean, the faculty. You really get to learn different things and different perspectives and see things. You see different people approach patients so differently. And there's a lot of value in that because everyone's different. Everyone's come from different backgrounds, different training. And even though everyone's still like on a relatively similar page, there's a little bit of warranted variability in kind of what they do. So, and that's really good because, it's sometimes someone, I'll see something from someone, I'll see something from another. I'm like, wow, I don't know how you both saw that. Like I never would have picked that out at all.
No, that's
So,
that's another good point too. I actually had a friend who finished the residency and then he got offered to be a faculty member. And
yeah,
so he was doing part-time clinical work and then part-time being a faculty member. And that's basically he graduated, did the residency, and already was a faculty member. And that's just
yeah.
such a great trajectory because sometimes that can take years to happen. So you're really right, like networking and even in the future for collaboration or even more questions if you have a tricky patient, yeah, it's definitely always great to have those extra set of resources.
Well, absolutely. And I mean, I think obviously the other big elephant in the room is that clinically, definitely, you're probably going to get a lot more improvement, probably faster than you would have. I mean, is that required and is that same by everyone? No, of course not. I've seen some very incredible individuals do it on their own and grow at an exponential rate on their own. I'm not saying and that's not everyone. But I mean, there is some evidence. I mean, there's not a lot of evidence regards to residency fellowship education because it is in its infancy right now still.
Yeah.
But from the few studies that we do know is that the big one is, of course, Rodagero, where they looked at outcomes between non-residency trained, residency trained, and then fellowship trained. So they looked at patient outcomes. They found is that like basically residency trained performed kind of at the same level as non-residency trained in terms of outcomes, but fellowship was actually statistically significantly faster or more efficient. Is that study perfect? No, it's definitely not generalizable, but it's a start.
Yeah. Well, I think that makes sense because you're saying that fellowship is very, very specific. So I'm
Yeah.
sure that those people are, let's just take that they had a spine fellowship. I'm sure then they're treating mostly spine patients, mostly
Hmm.
patients with spine pain or anything like that. And so you can see that if they have those extreme skills, they're going to be more successful than someone who's a little bit more of a generalist.
Sure.
So that's really interesting. Now, what about some negatives towards a fellowship and residency? Like, what would
Well,
be the downsides of it?
number one is obviously money. Because it depends. So if it depends, because if your employer is going to help you cover that, then it's obviously a little bit less of a blow. But finances comes to mind almost immediately. Residency programs, fellowship programs are not cheap. Like fellowship program from just the main part's about 12 grand in total. And that's not including travel to sites for traveling for mentorship and paying for that. So it's quite a hike. And then the other downside is it's just a lot of time and it's so much effort that, you kind of don't have as much time to focus on maybe other life things as much as you might want. Of course, you can have balance, and I'm not saying you just live under a rug, but you definitely do give up a significant more amount of your time focusing and studying and really refining.
Yeah.
So those are the big things. And I think, yeah, no, those are the big ones that come to mind.
It's almost like a continuation of school. We were so
Yeah.
devoted in school, we were working so hard. So it's almost like you're treating patients and you're still in school now a little bit, would you
Yeah.
say? Yeah.
Yeah, that's pretty accurate. I mean, definitely not as extensive as school where you're like in 5 classes at once. But it is there's definitely a similar sentiment of that for sure.
Okay. Now, I know we're going to be diving deep into how to find residencies and fellowships, but before we move away from the pros and cons, can you help us compare residency to fellowship? Like for you, you chose a fellowship. So how did you go about choosing between the two? Like I really want to
Yeah.
know, how do people choose? Because it seems like they're very similar and the benefits are almost very similar. So why choose one or the other?
Yeah. So usually, generally speaking, residency is more geared to kind of a clinician who's definitely much newer. So we're getting right out of school within maybe a couple of years. Fellowship definitely is more for someone who's been out for a few years, taken more extensive continuing education or development in that setting, and programs have kind of deemed them having enough prerequisite knowledge to be able to enter a fellowship program. So kind of why I did it. So one of the big reasons why is because I really wanted to get better for fellowship wise at clinical reasoning. I felt like I kind of had a really good overall sense of orthopedics and such. Of course, could I improve? Of course I can. But I felt like I really kind of knew the basics really kind of well. And I really wanted to get that deeper dive in mentorship and really refine clinical reasoning. And that's one thing that my program is very well known for. And with the rules as they stand now, I was like, I technically don't need to take the test or take a residency to get in. So I'm wondering if I could just bypass that and just go straight into fellowship. So I actually talked with the admissions director from that, and we talked for a while. And then I was kind of like, should I do the manual therapy certification beforehand and then transition in? And we were talking about that. And long story short, we basically said, yeah, you should probably just jump right into fellowship, because you have to do part of that anyway when you get in. So it kind of just made the most sense just to do it that way.
Okay.
So that's me though, and I think it really depends on where you at career-wise and what do you want to do, because not everyone needs to do residency fellowship. I don't think everyone necessarily has to now. I know there's work that's being done and there's talk that's being done to make that the normal continuum after graduation. I mean, we're talking years, like many, many years, because that we have to overcome the costs, supply of programs, and there's a lot of things that would have to happen over a longer term to make that a reality. But I can't justify saying as it stands exactly now that everyone needs to go into a program.
No,
You know,
I agree with that. I mean, right now, I don't see a lot of pay differences for someone that's in a residency versus someone who's not in a residency. But I know that's a whole big conversation right
for
there.
sure. But what's interesting though is that for fellowship, we're actually finding some preliminary stuff that actually people actually do get that ROI. They actually do get a little bit more.
Good, they
Um,
should. They
They
should.
do. They do. And it's a lot of it. It's not always just clinical, but they tend to pursue other avenues. So faculty, leadership in different roles. Now, how exactly that income comes from, I don't know the specifics, but I do know that they're finding that more fellows are going more into those roles, and therefore, the finances is definitely more of a return on investment compared to a residency. But most people, if you ask most people why they're going into residency and fellowship, it's not money. It's not money. It's really, they want to get better. They really want to refine and become the best version of the clinician they can be. Some people might want to use it for maybe more getting into other avenues of work. Like, I know a big thing fellowship wise, and if you get fellowship training or board certification, that can look really good if you want to end up being a clinical faculty member. So there's definitely some other reasons why people might do it, but I don't usually don't hear making more money being one of them.
Gotcha. Now, a quick question. Say you have someone who's a new graduate, just graduated, and maybe 0 to 1 years of experience. Will they not get into a fellowship? Like, should they not even apply? And I know, you're not an admission expert on this,
Right.
but do you think that they even have a chance going right into the fellowship? Say they really want to get those specific.
Yeah. I don't think so. I mean, I don't know exactly 100%, but I don't know many programs fellowship wise that would probably do that.
Yeah. Because you just need,
you got to get your feet wet first. You got to get on your feet.
Yeah. If you don't even know how to treat the spine, you can't be a spine specialist yet.
Yeah. Now I don't know proof of that, but I'm just anecdotally, my gut's just telling me.
Gotcha.
I doubt that.
Gotcha. And it would probably be a little bit more of a struggle too, for someone going right into the fellowship. They may feel overwhelmed because
absolutely. Even we're overwhelmed.
So
we're all overwhelmed.
Before the summit started, I asked Brandon a little bit about how the fellowship was going, and it's quite rigorous. And so that's good to know. So basically, if a new grad wanted to do extra education like a residency or fellowship, your recommendation would be to seek the residency and then go from there if you wanted even further specialization for the fellowship. Okay.
Sure, but again, it also depends. It depends on what your career goals are too. Because I've seen plenty of clinicians that develop very well independently without a residency, and they're doing awesome.
Oh yeah, 100%. I don't think it's necessary.
Absolutely.
Yeah.
Absolutely.
Very good. Okay, so say we do want to do a residency or fellowship, how do we even go about sort of searching and finding one?
So the best thing you're going to find is all the accredited programs from a residency fellowship point of view is going to be on the AbTree website. Okay. And what they have is they have a whole list of directory of programs, and they have it kind of defined by specialty, and they'll kind of give you the basic information about it, all the little details. But then how you apply for it is actually through, it's sort of similar to PTCAS, except it's RFPTCAS, excuse me. So basically residency fellowship, PTCAS. So depending on what program you would choose, you would kind of submit the application, your essays, letters of rec, and whatever the program had required through there. But first, I think you got to figure out which program is right for you if you want to do that. And there's a couple things. And one thing so believe it or not, I don't think I told you this, but after my first year, I actually applied for a residency. And what I ended up doing actually was I was kind of chatting back and forth with the director. I talked with a couple of residents. I did a site visit beforehand. I checked it out beforehand. But then I interviewed, and I actually didn't get it following that. So, but what I did learn from that is that if you really want to find a good place, if you got to really look at the people that you're mentoring, that you're going to be with, and see, is this a group of people that I really want to learn from and that I want to be like? Because you're going to spend a lot of time with these people over the next year, and you got to figure, are they people you jive with? Are they people who you could learn from and you could be proud of at the end? I'm not trying to say I think residency people are bad. I'm not trying to say that. So please don't take that out of context. But you got to figure out who you jive with and who you like. And that's why there's nothing wrong with, I think, talking with people, current, like even past residents, mentors, asking, hey, can I observe you sometime? Can I just see what it's like just to get to know you? Because you want to make sure it's a good fit for you, because otherwise, if you're in a wrong fit for a while, that'd be a miserable year.
Definitely. Well, and I really like that idea, because this is a big investment. This is just like going to PT school or any other graduate school. This is another huge step of a year to several years of your life. And so I really like the fact that you even mentioned speaking to past residents or past fellowship people, because they can probably give you like insights into how
Mhm.
to navigate the residency, how to navigate the fellowship, and almost how to get the most out of it. Like,
Right.
as you know, as someone entering PT school, that's what I often tell people is try to speak to other therapists, because we can tell you all the things that we wish we would have done in PT school. So
Right. Well, and the people that have actually just passed it are probably going to have your best real source of information because they just went through it.
yeah.
So if anyone's going to give you that kind of the real details and answer those questions from a resident point of view, that's probably a really good chance you're going to get a really good answer from them.
Yeah, yeah. And they're going to give you, I think, maybe the most unbiased answer too. You know, someone at the admission coordinator, someone else, you know, they're going to give you from a teaching perspective view, but you really want from a student perspective's view.
Well,
Yeah.
it's good to have both. And I
Yeah.
think there are I mean, I've met some program directors who are very good and say that very well. You know, I can't say I've met one that's not, but I get your point completely. I totally do.
Yeah. Any other really helpful things to help you decide? Like, were there, when you chose your fellowship, was there like key pieces
Yes.
in that
Oh
you
yeah.
really stuck out?
For sure.
Yeah.
So for me, the couple things that chose me about that I really chose EIM was their name, um, their brand, because obviously seeing what they've done in the past and their reputation for being excellent at building people that have really solid clinical reasoning. That was one big one. The second big one was a hybrid program, because as it stands now, I cannot just pick up and leave and just go clear across the country or something like that to do a program. That's not going to work out for me personally. So I made that choice. I had to choose something that I could do at home, and I wanted to choose something that really had a good reputation. So that's kind of why I chose it. I do think for some other people, of course, obviously cost, location, what are some of the other opportunities that are involved, like extra wise, like for some sports residencies, I know they do a lot of game coverage. I know there's others that are more involved in research, some that are more involved in maybe teaching. Um, so, you know, you got to figure out kind of what avenue do you like? Because if you want to be a researcher, you probably want to get more along the lines of one that has more research. You know, if you want to do more like actual game sideline coverage, you probably want to choose a program that has more emphasis on that, maybe comparatively.
Yeah, no,
So,
that's a really good point. Sort of like, where do you want your career to go? Where do you see that? And
right,
then does that program have those extra perks that could
right,
get you even closer to being, on the field or behind the stage or something like that?
absolutely.
Yeah. No, that's a really good point. Anything else that you want to mention in terms of residency and fellowship? Like any key takeaways that you've learned in your fellowship program so far?
Oh my God. Well, there's a lot of stuff I've definitely learned regarding the process and basically learning how my clinical reasoning has been wrong. And I've been doing so many things wrong this entire time. I'll spare you those details though. But one thing I do want to mention is kind of what we had kind of briefly touched on earlier
Yeah.
about the admission requirements. And I'm not sure how much your audience is aware, but within the past couple of years and even within the past kind of more the fall of 2018, there has definitely been a big issue within residency fellowships in terms of between ABTRI, which is the APTA accrediting body, and program directors of residencies and fellowships. This is a big topic. I would definitely recommend if you want to gain a little bit more insight on this. We did do a couple episodes that dive into this avenue much more in depth, and these people are much better at explaining this than I am. So I can definitely hand you those links, and if people want to listen to it to gain more insight, that's absolutely fine. But long story short is that ABTRI has made some changes that were going to significantly affect residency and fellowship. One of them being, of course, the admission criteria, you know, having to have residency training or board certification or to enter a fellowship. There was also big changes in regards to physical site visits for programs. So basically what would happen is a lot, depending on how many new students you would get in a program, I forgot exactly how many you have to have, but long story short, you'd have to have a site visit for where they work and where they're going to be mentored. And if you have a program with any size, that's going to be a huge amount of money that because the AbTree site visitor has to fly down, check it out for a day or two, and then go back up. And because programs have to often maintain a neutral budget, they end up having to get that cost from where? The student. So that's going to drive up the cost. And a big argument is, why are we doing this? You know, so that's one big avenue of it. They've also kind of changed the mentorship requirements. beforehand IFOMP. So there's AOMP, so there's ABTRI, and then there's IFOMP standards. So IFOMP basically is the International Federation of Orthopedic Manipulative Therapy. So they're kind of like the global international body of manual therapy in orthopedics. And they kind of have set the standards for residency fellowship initially. But what's going on now is that their standards for IFOMP basically require that your mentors had to have, of course, board certification and be a fellow in order to be a mentor. However, these new ABTRI requirements, that's not necessarily the case. They don't need that. So the questions being raised, why are we letting people be mentors that are less qualified on paper than the applicant?
That makes, I think those are good questions to raise. That doesn't really make sense. I mean, you're going to get a fellowship and you're going to spend all that time. You want the highest credentialed mentor. You want the cream of the crop, and not have that is disappointing. That's disappointing.
Sure. And the big thing is just kind of really wanting to understand the reason, because at the end of the day, it kind of makes sense in some ways what ABTRI is trying to do. It does. The problem is just that some of the little things that they wanted to do with this have some really significant unintended consequences that could really hurt a lot of things. And it got to the point where these changes were really threatening a lot of programs financially, and they weren't able to stay open. So 20 out of 26 programs for fellowships, for orthopedic fellowship programs, basically had sent a letter to ABTRI basically saying, if this isn't changed, we can't if we can't move forward with this, we're going to leave and we'll seek accreditation somewhere else. So that would have been bad, because then we would have had two different sets of programs. Because right now the standards are different between IFOMP and ABTRI. So we have two different fellowship standards. That's kind of an issue. So there was a focus group that took place in April. And basically what happened was select people from ABTRI, APTA, and programs basically met to talk about the site visit issue, because that was by far the most pressing issue for a lot of them wanting to kind of just be willing to abandon ABTRI. Long story short is they were able to negotiate, and they are slowly moving forward with negotiating and turning that around. So that is positive.
That's good.
Where they stand on the admissions criteria and the mentorship, to my knowledge, that has not been formally decided, and that has not been formally discussed at a similar level as that focus group. But for all I know, that could have changed recently, for all I know. So it's a big issue, because a lot of these do have an impact off if you want to do fellowship training, because a lot of program directors have basically said that most of their fellows are not residency trained, which is really interesting. So they're like, if we put in that criteria admissions, we're going to be screwed.
Yeah, it's gonna limit your application.
Right. And instead of scaling it like they want to, it's going to have the opposite effect.
Yeah. Well, I also think, I come from the standpoint as to, in physical therapy, we worked really hard to get our doctorate. And now you're asking for a residency, and then now you're asking for a fellowship. And I think these are great things to grow your clinical skills, make you feel like a more competent, a more, empowered clinician. But at the same time, like, we've already gone through a lot, and I don't want there to be even more roadblocks to new graduate success, and even more roadblocks to the learning. If you add this residency requirement to fellowships, well, what happened to the people who didn't know that they wanted to do something until later in their career? You're almost preventing them from becoming a better clinician. So
sure. And I think another point is that a lot of residents already paid a lot of money for that residency.
Yeah.
And then they're going to have to pay a lot for the fellowship on top of that as well. And a lot of them probably have to pay for board certification as well. And that's not a cheap test. That's like a couple grand, I think.
Yeah, definitely.
So, I mean, I don't know. I'm encouraged that at least things are starting to move. Discussions are starting to move in a way that we're kind of avoiding the trains derailing.
Good.
So that is optimistic. It's still not 100% resolved, but I am more optimistic.
So basically, if you're thinking about doing a residency or a fellowship, do a lot of research beforehand.
Yes. If you want to do fellowship and you're not going to plan on doing a residency, do it before 2020.
Gotcha.
Apply and get in before 2020.
That's good to know. Well, any other key takeaways you want to give to the people on the summit in terms of a residency, a fellowship, and anything you've learned in your process?
I think the big thing is, apart from what we have talked about already, is that post-professional education, I think, is a good thing. It's something I know there's the debate, should it be mandatory? And I don't think so. But that being said, I would never say no to leveling up the profession, but I can't get behind that cost that it's going to come with
Yeah.
at the same time. So I think in an ideal world, ideally, if it was financially sustainable and there was enough supply, I'd say absolutely. I don't have a problem with that, because we have to look at the limitations of entry level education DPT. There's no way we can become a super specialist given all that. That how it is the way it is. I wish it were. I really do, but I know as it stands right now, that's just not realistic. But I think, in terms of residency fellowship, I think at the end of the day, you got to think about where you want to go with your career. That's probably the biggest thing, is really see where do you want to go and why do you need that to get to where you want to go.
Yeah.
Because there's some people that really they're like, I want to get involved with this group. I want to get involved with this initiative and this team. I want to learn from this researcher to do this. Great. That makes perfect sense. But then there's some that are like, well, I want to do it just because I want to do one. I'm going to challenge that a little bit.
So
there's got to be a why.
You got to be passionate is what I'm sensing. You really
passionate.
have to be really passionate, really be like an avid learner, want to learn more
Absolutely.
in order for this to be a good choice, good decision for you.
You got to make the most of it, because honestly, it's challenging. You're going to get pushed. You're going to get critiqued. You're going to mess up. You're going to learn. You're going to move forward. It's challenging and it's hard initially, but once you get past it, the growth that comes from it is incredible. So that good old phrase, you got to get comfortable being uncomfortable, is so true.
No, that's a good phase. And now, in terms of the fellowship, where do you see your career going after this? Like, what are your career goals after? I know I threw in a surprise question there.
Oh, I know, man. I'm totally not ready for this. No. So after doing this, I have had some thought about kind of what I want to do. I have a couple avenues that I want to kind of explore more of. Of course, after this, I would like to get more involved in some realm of teaching, whether that be more clinical based. I think that's where I'm leaning towards now. I'll keep the door open on going into a university, but I'm not sold 100% on that yet.
Yeah.
But I do want to continue. I do want to serve and help contribute to some of the organizations with education reform. I think it'd be cool to be an item writer eventually for either the specialty or the licensure exam. And there's other avenues I kind of want to get involved in with HET, something that we're going to be doing down the road, not recently, but we're going to actually be trying to do a junior faculty course online module. So because a lot of faculty we've heard really kind of feel rather lost when they're entering academia and how to navigate that and how to be successful at it. So we're going to pool tons of different people from different avenues to really help put together a product that can really help ease that transition. But also, we want to try to also help foster individuals to really, truly be change agents that we know that we need. Because I don't want to just be complacent. I want to have people that really want to push the envelope and push things forward and make change. Now, we realize that we have to teach people some basics of how things are right now. We have to understand the basics of these organizations, how they affect education, and the basics of how to get things done right now, for sure. But apart from that, we want to have people be creative, challenging, and really push things forward. So that's definitely not in the immediate future, but down the road, that's something we're looking to do.
Awesome. Well, I'm looking forward to that. I'm excited and eager to share that with everyone when it comes out. Well, Brandon, you have been a wealth of knowledge. I feel like I've learned so much more about residency and fellowship and how to choose which one or the other, and then really how to choose in general if this is the right career path for myself as well as new graduates out there. Everyone, thank Brandon, and also don't forget to go to his podcast, the Healthcare Education Transformation Podcast, because he's got tons of amazing information like this on different educational avenues and amazing speakers, and it's just really great information. So thank you so much, Brandon.
Well, thank you so much, Emma. And if anyone wants any more information regarding what we've talked about, or, feel free. There's definitely some episodes I would highly recommend or some articles I'd recommend. And if anyone has a question for anything, or they just want to learn more, always can email me. That's completely fine. I'm okay at my email on most days. But it's just my name. So it's BRANDON, P as in Paul, poen@gmail.com. And I'm more than happy to answer any questions or point someone the right way depending on what they need.
Perfect. Thank you so much, Brandon, for that generosity. And we'll share all those links below so you guys can find everything below this video. Thanks, and we'll see you later.